Hey everyone, and welcome to our video on supplements for vision and maintaining healthy eyesight. In this video, we'll be diving into the key vitamins and nutrients that have been shown to support eye health, including vitamin A, beta-carotene, vitamin C, vitamin E, lutein, zeaxanthin, zinc, omega-3 fatty acids, and B vitamins. We'll also be discussing the findings of the age-related eye disease studies, or AREDS and AREDS2, which investigated the effects of high-dose vitamin and mineral supplementation on the progression of age-related macular degeneration and cataracts. By the end of this video, you'll have a better understanding of the role these nutrients play in maintaining healthy vision and how you can make informed decisions about your diet and supplement choices to support your eye health. So let's get started. First up, let's talk about vitamin A and beta-carotene. Vitamin A is crucial for maintaining healthy eyesight, especially in low-light conditions. It plays a vital role in the formation of rhodopsin, a pigment in the retina that enables night vision. On the other hand, a vitamin A deficiency can lead to night blindness and dry eyes, causing discomfort and impairing vision. Beta-carotene, which is found in many fruits and vegetables like carrots, sweet potatoes, and leafy greens, is a precursor to vitamin A. Your body converts beta-carotene into vitamin A as needed. Several studies have suggested that diets high in vitamin A and beta-carotene may reduce the risk of developing cataracts and age-related macular degeneration, or AMD. For example, a meta-analysis by Zhang and colleagues in 2014, published in the journal Public Health Nutrition, found that higher dietary intake of vitamin A was associated with a lower risk of age-related cataracts. Another study, the Rotterdam study, which followed over 4,000 participants aged 55 and older for an average of 8 years, found that those with higher dietary intakes of vitamin A and beta-carotene had a significantly lower risk of developing AMD, according to Van Leeuwen and colleagues in their 2005 publication in the Journal of the American Medical Association. The eye disease case control study, published by Seddon and colleagues in 1994, in the Journal of the American Medical Association, also found that higher consumption of foods rich in vitamin A and beta-carotene was associated with a lower risk of AMD. Moving on to vitamin C, also known as ascorbic acid, which is a potent antioxidant that helps protect the eyes from oxidative damage. Oxidative stress has been implicated in the development of cataracts, and vitamin C may help prevent or slow their progression, as discussed by Thiagarajan and Manikandan in their 2013 publication in the journal Nutrients. Several observational studies have found an association between higher vitamin C intake and a reduced risk of cataracts. For instance, a prospective study by Hankinson and colleagues published in the American Journal of Clinical Nutrition in 1992 found that women with the highest intake of vitamin C had a 45% lower risk of developing cataracts compared to those with the lowest intake. The Nurses' Health Study, published by Jack and colleagues in the American Journal of Clinical Nutrition in 1997, followed over 120,000 female nurses for 8 years and found that those who consumed the highest amounts of vitamin C had a 38% lower risk of developing cataracts. Next, let's discuss vitamin E, another powerful antioxidant that helps protect the cells in the eye from damage caused by free radicals, according to the Office of Dietary Supplements. Some studies have suggested that high intake of vitamin E through diet or supplementation may reduce the risk of developing cataracts. A meta-analysis by Zhang and colleagues, published in Public Health Nutrition in 2015, found that higher dietary intake of vitamin E was associated with a lower risk of age-related cataracts. The study included 7 prospective cohort studies with a total of 445,837 participants and found that those with the highest intake of vitamin E had a 17% lower risk of developing cataracts compared to those with the lowest intake. Lutein and zeaxanthin, carotenoids that are concentrated in the macula and retina of the eye, act as natural filters, protecting the eye from harmful blue light and providing antioxidant protection, as discussed by Bernstein and colleagues in their 2016 publication in the journal Nutrients. Several studies have suggested that lutein and zeaxanthin may help prevent cataracts and slow the progression of AMD. The Age-Related Eye Disease Study 2, or AREDS2, published by Chu and colleagues in the Journal of the American Medical Association in 2015, found that supplementation with lutein and zeaxanthin, along with omega-3 fatty acids, reduced the risk of progression to advanced AMD by 10% in participants with intermediate or advanced AMD in one eye. A meta-analysis by Ma and colleagues, published in the British Journal of Nutrition in 2012, also found that lutein and zeaxanthin supplementation significantly improved visual acuity and contrast sensitivity in patients with AMD. Zinc, an essential mineral concentrated in the retina, plays a crucial role in helping vitamin A create melanin, a protective pigment in the eye, according to the American Optometric Association. The Age-Related Eye Disease Study, or AREDS, found that a combination of zinc, antioxidants and copper reduced the risk of progression to advanced AMD by 25% and the risk of vision loss by 19% in participants with intermediate or advanced AMD. Omega-3 fatty acids, particularly docosahexaenoic acid or DHA, are found in high concentrations in the retina and help protect against inflammation and damage, as discussed by Downey and Keller in their 2015 publication in the journal Clinical and Experimental Optometry. Some studies have suggested that omega-3 fatty acids may benefit those with dry eye disease by helping to produce more tears and improving tear quality. A systematic review and meta-analysis by Melina Leva and colleagues, published in the journal Nutrients in 2020, found that omega-3 fatty acid supplementation significantly improved dry eye symptoms and increased tear production. Another study by Downey and Keller, published in Clinical and Experimental Optometry in 2015, surveyed optometrists in Australia and New Zealand and found that 80.5% recommended omega-3 fatty acid supplementation for the management of dry eye disease. B vitamins, particularly vitamin B6, B9, folate, and B12, may play a role in reducing the risk of AMD by lowering homocysteine levels. High levels of homocysteine have been associated with an increased risk of AMD, according to a study by Gopinath and colleagues, published in the American Journal of Clinical Nutrition in 2013. The study, which included over 2,000 participants aged 49 and older, found that those with the highest intake of folate and vitamin B12 had a significantly lower risk of developing AMD compared to those with the lowest intake. Vitamin B3, or niacin, deficiency has also been linked to an increased risk of glaucoma. A meta-analysis by Lee and colleagues, published in the journal Nutrients in 2018, found that higher dietary intake of niacin was associated with a lower risk of glaucoma. The study included a total of 241,679 participants and found that those with the highest intake of niacin had a 21% lower risk of developing glaucoma compared to those with the lowest intake. Now let's talk about the Age-Related Eye Disease Studies, or AREDS and AREDS2, which were landmark clinical trials conducted by the National Eye Institute to investigate the effects of high-dose vitamin and mineral supplementation on the progression of AMD and cataracts. The original AREDS trial included 3,640 participants, aged 55 to 80, with varying stages of AMD. The study found that a daily supplement containing high doses of vitamin C, 500 mg, vitamin E, 400 IU, beta-carotene, 15 mg, zinc, 80 mg, and copper, 2 mg, reduced the risk of progression to advanced AMD by 25% and the risk of vision loss by 19% in participants with intermediate or advanced AMD in one eye over a period of 5 years, according to the National Eye Institute. The AREDS2 trial, which followed the original AREDS, included 4,203 participants aged 50 to 85 with intermediate or advanced AMD. The study investigated the effects of modifying the original AREDS formula by adding lutein, 10 mg, and zeaxanthin, 2 mg, and/or omega-3 fatty acids, 1,000 mg, as well as removing beta-carotene and lowering the zinc dose to 25 mg. The study found that the modified formula with lutein and zeaxanthin without beta-carotene was as effective as the original AREDS formula in reducing the risk of AMD progression, as reported by the National Eye Institute. The AREDS2 trial also found that participants with low dietary intake of lutein and zeaxanthin benefited more from the addition of these nutrients to the supplement formula compared to those with higher dietary intake, as discussed by Chu and colleagues in their 2015 publication in the Journal of the American Medical Association. This finding suggests that individuals with low consumption of foods rich in lutein and zeaxanthin, such as leafy green vegetables, may benefit more from supplementation. In summary, the AREDS and AREDS2 trials provided strong evidence for the use of high-dose antioxidant and mineral supplementation in slowing the progression of AMD in individuals with intermediate or advanced stages of the disease. The studies also highlighted the importance of lutein and zeaxanthin in protecting against AMD, particularly in those with low dietary intake of these nutrients. In conclusion, maintaining healthy eyesight is a complex interplay of various factors, with nutrition playing a crucial role. A balanced diet rich in fruits and vegetables is the foundation for good eye health, as it provides essential vitamins, minerals, and antioxidants that support the function and protect the structures of the eye. However, certain supplements may offer additional benefits, particularly for individuals at higher risk of developing age-related eye conditions, such as cataracts, glaucoma, and macular degeneration. While supplements can be beneficial in certain situations, it is crucial to consult with a healthcare professional before starting any supplement regimen. High doses of certain nutrients may interact with medications or have adverse effects, particularly in individuals with pre-existing health conditions. Additionally, supplements should not be considered a substitute for a healthy lifestyle, which includes a balanced diet, regular exercise, and protection from UV light. By adopting a comprehensive approach to eye health that encompasses both nutrition and lifestyle factors, individuals can take proactive steps to maintain healthy vision throughout their lives. If you found this video informative and helpful, be sure to visit nutritionmarket.com.au, where you can find a wide range of high-quality supplements to support your eye health and overall well-being. At Nutrition Market, we also have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to receive personalized advice and guidance on maintaining healthy vision. Don't forget to hit the like button and subscribe to our channel for more informative videos on health and nutrition. And remember, while the information provided in this video is based on scientific research, it should not replace advice from your healthcare provider. Some of the findings discussed may still be under investigation, and it's always best to consult with a professional for personalized recommendations. Thanks for watching, and we'll see you in the next video.